In this video, I'm going to be walking you through our progress notebook. And in the past video, I've shown you our basic H&P notebook. This one's going to be a little bit different. And what this is designed for is really for inpatient setting. And you'll see why in just a second. Comparing it to our H&P notebook, which is our standard H&P notebook, it really only has a H&P template. This one is going to be a little bit different where both the H&P template is catered more for an inpatient setting, but in addition, it's got 2 additional pages for your progress template, right? So in each of these, this would be the setting of I'm going to be seeing a patient when I'm first admitting them. I'm going to be filling all this. I'm going to be filling out their problem list, what I need to do for them, kind of their inpatient bundle, and then the typical things that you're going to see from all the patient's information, the HPI, any type of events that happen, the ED, your past medical history, your meds, things like your social history, your family history, your physical exam, your labs, and things of that. Then the next page is going to be as you go on in the admission process, or I should say more so in the patient's admissions process. When they're there for the second day, then you're going to have a SOAP note here. When they go on their third day, then they're going to have this other, so on and so forth. There's going to be 4 total days that you're going to have in addition. So when you see the patient the next morning, and you can kind of have what their one-liner is when you're going to have a presentation. You're going to have what hospital they're on, the date, what type of overnight events happened last night, how they're feeling, their objective, their physical exam, their ins and outs, and then labs. So it's very short. And then here you'll have your assessment and plan and your to-dos. And really, most of the bulk of the thing when you're going through a presentation, when you're on either medicine or surgery or whatever it may be, you're going to be filling all of these things out before your presentation. You're going to see the patient, fill out the objective and physical exam, and really only putting the key points. That's why it's much smaller. And then you're going to be either filling this out before, just kind of quick notes. These are the patient's problems, and then you may have a quick plan of, we're going to change one medication, our metope is going to be from 5 to 10 or whatever it may be, some type of small changes that you're going to make. And then maybe in this second column you can say, okay, well, now this is what the attending actually wants, this is our actual plan. Then when you write your notes, you can kind of go back into your little diary here and be able to remember what exactly was our plan for each of these patients. Because you can imagine, when you're on a surgery service, you're going to be having 5-10 patients at a time, remembering all their to-dos and just kind of going through them. The benefit of this format, and the reason why we made this, is that, for example, let's say you have 5 patients, you're trying to figure out, fumbling through all your papers, where you lost some of them, you don't know which patient is which, you can kind of flow through each one. Okay, what were they initially coming in for? Okay, I remember now, let me go to the HPI. Okay, we're on day 4 now, but what was their labs from their first day of admission? So you can kind of look back and go and compare and contrast. Then you can go on to your next patient and have everything in a very organized manner, all here for you, okay? So that's kind of the benefit of this, the actual information in each of these templates. There's room for anything that you might need to present on or may need to ask that we found to be relevant. And each of these is going to become, with all of our other notebooks, just like those, you're going to be having some type of reference sheet that can kind of just guide you through if you need to remember anything kind of on the fly. Be sure to check out medicalbasics.com for more educational resources like our H&P notebook, and don't forget to subscribe to our channel for more tips and lessons.